So it is Christmas Day, and you respond to a 19-year-old male who fell while ice skating. He experienced a lucid interval before developing a worsening headache and vomiting. He now has a blood pressure of 162 over 84, heart rate 54, respiratory rate of 10, SpO2 of 98%, a declining mental status, and fixed dilated left pupil. Where is this bleed occurring? Would you say A, subdural, B, intracerebral, C, subarachnoid, or D, epidural? Now, this is a very bad Christmas for this patient. Now, if you know anything about ICP and head injuries, we can all agree that this is a lot of late signs that we're seeing. The hallmark sign of this specific bleed is going to be the lucid interval. This occurs sudden. It's an acute onset after the fall, so after the insult. So if somebody hits their head, sudden loss of consciousness, followed by them regaining consciousness and then potentially losing consciousness again. Like they wake up, they might say a couple things and then pass back out. These are known as lucid intervals. It's not going to happen days after the event, right? This happens right after the insult. Whenever we look at bleeds, some bleeds are very slow, venous bleeding. Some bleeds are very fast. In this instance, somebody who has a lucid interval has an arterial bleed. And this arterial bleed occurs in the epidural space. So there's some other really bad signs that we see with this patient in particular. Take a look at that blood pressure, 162 systolic for a 19-year-old who hit their head with a heart rate of 54, now breathing 10 times a minute with a blown pupil. This patient is herniating. And what that means is that the pressure is building up so much in that cranial vault that it's pushing down on that foramen magnum and the brainstem. And we're getting this Cushing triad vital signs. Some of these other ones that we see here, A says subdural. Subdural is a much slower bleed, right? This person may have hit their head and then days later, now they're showing signs and symptoms, neurodeficits, maybe they lost consciousness, whatever the case might be. And over here with a subarachnoid bleeds are often on exams with thunderclap headaches or like the worst headache this patient ever had in their life. That is usually how they'll paint the picture of that patient. Now, to be honest with you, intracerebral bleeding is not something that we would see commonly in these type of exams, but that just means that bleeding is occurring within the brain tissue itself. And depending on where that bleed's occurring, that patient's going to have those deficits. So it could be maybe vision loss, it could be facial droop. There are very specific signs and symptoms that somebody might experience depending on what part of the head or what part of the brain is damaged. Now, to everyone who's on shift, I hope you have a safe shift. I hope it is the best shift of the year. And for those of you who are on break, enjoy your break, but do not slack on your studying. You got tests when you get back to school. And of course, I will see you on the next one.